Hello, my name is Ginger Browning and I'm the Airway Clearance Specialist at Cincinnati Children's Hospital and the Outpatient CF Clinic.
And my name is Carolina Sprinkle and I'm the CF Coordinator on the inpatient side of our CF Center.
And now we're going to talk about the Aerobika. The Aerobika is an oscillating PEP device. It is a great portable modality, but it is very patient effort dependent. So I always tell my patients what you put into this is what you're going to get out of it. So if you put poor effort into it, you're going to get poor effort out of it. A couple things about the device. It has different resistance settings, which is just your positive pressure. So when they breathe against the resistance, it causes a positive pressure in the airways that kind of pop open, so air gets behind mucus and pushes it up. When I get this device brand new out of the package, it is usually set on about 20 centimeters of water pressure, and that is a good therapeutic start. If I find that this is too easy for them, I can turn it one notch to the right, which gives it 25, and all the way over gives it 30. So back in the middle, if it is too hard for them, I can take it down a notch, which takes it down by 5 points each time too. So it would go to 15 and then 10. So what you want the patient to do, you want them to put this in their mouth. You want them to take in a big deep breath, hold for 3 seconds to allow your collateral airways to open up so air can get behind the mucus and push it out. After the breath hold, they want to exhale into the device with enough force that I can feel it. So I want to put my hand on the back of their lower lungs and I want to feel that vibrations. If not, they need to exhale out harder. When they exhale out, they want to try to keep their cheeks stiff. You really don't want them puffing out their cheeks because they're going to lose some of the resistance and the vibration in their cheeks as opposed to their chest where it needs to be. The goal for them is to do 15 breaths for 6 cycles, and they should do it consecutively. They should not stop to talk to you because they're going to lose some of that pressure that they're building up in their chest as they go through the cycles.
So just to touch base a little bit on the medications that we run during an Aerobika treatment, we're always going to start, if they have a bronchodilator ordered, that's going to go first, their albuterol, and then any mucolytic, of course, would go before the Aerobika. So your Pulmozyme or your hypertonic would always go before this. We typically don't run the medication through here, they just do the medication before. And then if they're on any kind of antibiotic or steroid, of course, that would come at the end of airway clearance after they've done their 6 sets of 15 with this and done all their huff coughs. Then they would do their antibiotic or steroid, what else they have left to do. Sam's going to help us out with a demonstration of Aerobika. So if we were going to start an Aerobika treatment with Sam, she would do her albuterol first, her bronchodilator, and then she would take her mucolytic, whether it be her hypertonic or Pulmozyme, whichever treatment she was on for that day. Then she would start her airway clearance with Aerobika. If we're instructing Sam on how to do this, she wants to take a big deep breath in and hold it for about 3 seconds, and then make sure she exhales long enough for about 5 to 6 seconds with each breath. And she's going to do 6 sets of 15 breaths like that. So she's going to demonstrate one of those cycles for us. And a good breath hold and blow. Good breath hold. 1, 2, 3, 4, 5. Big deep breath in. Good job.
So I like to use the Aerobika when I'm on the go. If I need to get somewhere and I have a certain amount of time to get there, I feel like that helps a lot. I don't want to do it on days where I don't feel as well because you have to really make sure you're taking good deep breaths and blowing out nice. So when I'm sick, you know, I might not want to lean towards that.
Okay. I think that's good. Good job. So after 15 breaths, 3 huff coughs. And of course, if she had any antibiotic or a steroid, that would be given at the end of her airway clearance treatment. But she did a great job with that. Thank you, Sam.